Wherever you're noticing hair loss, hair thinning, we want to make sure we debride the area. Basically clean it out so the follicles can actually grow. A lot of people will have buildup from sweat, product use, all these things. We don't want that debris there. We want to clean the scalp out. After that, we draw blood from the arm, spin it in the centrifuge, take out your stem cells and growth factors. We inject that where you're noticing hair loss. You want to do a minimum of 3 sessions. After 3 sessions, they're like, I can start seeing like the baby hairs come in and I can see it. 6 sessions, I'm like able to get like a visible photo of the before and after, like, dang, like you can see like big change. So at least 3 sessions, you do them on a monthly basis. And you want to minimize the triggers. So for you, you're saying nutritional and stress hair loss. So if we can figure out, I know it's going to be like, hey, don't be stressed. I know that's so easy to say, but like if we can minimize those stressors, that's going to help. You know, for other people, we see a lot of traction alopecia. So like, oh, I've had like my tight buns, I've had weaves, I've had braids for years and years and years. That will pull the hair out of the follicle. Dang, I'm like, this is giving me a little brow lift. Okay, sorry, that will pull the hair out of the follicle. So I got to tell the girls, I'm like, if you're doing this, no point in like investing in this if you're going to keep doing the same hairstyle super tight. We don't want to take 2 steps forward to go 3 steps back. So we want to talk about minimizing the triggers. One of my patients, he had been dyeing his hair, bleaching his hair. I've treated him as a patient for several years. And then he's like, I want to do something. He's like, I'm noticing, and it's for guys and girls and all hair textures, all skin tones, everybody. He's like, I'm just noticing like male pattern hair loss and I'm looking like my dad. I'm starting to see the early signs of it. Do it when you're seeing early signs, guys, not when it's like, I'm bald. It is hard to do it when you have had like a lot of stress on the hair and it's like a lot of hair loss. If you're starting to see it, I'm like, start now. We also recommend Nutrafol supplements. If you guys are ever interested in getting those, text our office. We get them cheaper than like what you can even get them on Amazon and from their website. They just send it to the provider offices for a discounted rate. So we have Nutrafol. We can do topical and or prescription medications. We do the scalp facial, red light therapy, hair massage. So it's like pretty relaxing. And then the needle pokes are not that relaxing, but it only takes a couple minutes. And we do that, like I said, minimum of 3 sessions. And then 6 is where you can start getting really excited about it. Okay, sorry. Okay, somebody said, Love Soul said, can I do sculpture after, I think she was saying after PRFM. So we don't do PRFM in our office, but we do PRF, Easy Gel. And yes, you can do that, not on the same day. We don't mix them and treat the same area. We separate the areas out. Okay, Golden said, I need the tip smaller. I don't know if I'm missing some of the questions, guys. I want to make sure I'm not missing it. If you're talking about for your nose, we can do, when we inject, we can like make the highlight look a little bit smaller by like accentuating the highlight sometimes. It's not actually going to pinch it in. If you have a very, very bulbous nose, sometimes I tell people I'm like really, really wide. I'm like, hey, this is not going to be best for you. What you're talking about is going to be a surgical thing. But I will show you full noses, black and brown, everybody's nose, so you can see like, yeah, we do it on people. If you want to say ethnic noses, yeah, we do it on fuller noses as well. And you can see outcomes and you can be like, hey, I like that and that's enough. Or no, I want something a little bit more dramatic, a surgical thing. And that's when I'll say, get a surgical consult. You know, I want you to make informed decisions. If you're open to surgery, know all the things and you can decide which one you want. Okay, she said, yeah, can I do sculpture after PRFM? Okay, I got that one. Okay, she said, same question. Okay, what skincare products do I use? I use their Jossie ones. And somebody told me earlier, they're linked. Finally, I figured out how to do it. That's all I use. I mean, anything I talk about, guys, I got to do it in the office. Like the only things I'm going to talk about, I have to like live and breathe it. So I don't want to be like using other random products and messing up the results that I'm getting in the office. No, I only use what's linked on there. I don't use the acne ones because I don't have acne, so I don't use our blemish cleanse, but I use our vitamin C, I use our recovery boost, resurface RX, our moisturizer, the cleanser, the exfoliator. And you gotta like, you know, read your skin and know when and how to use it. So not every day. I'm not using the retinoid every single day. I'm not using the exfoliator every single day. I am using the sunscreen every day and reapplying it. So that's all I use. I don't want to be mixing and matching random products because no, I know these work well. I know these work well with treatments. I honestly feel like they're an extension of the treatments that you get in the office. So I'm like, this I know works. I've seen it work not just on me, but on patients of all different backgrounds, different ages. And yeah, if you want prescription, if you're like, oh, I've been using a retinol for a long time, we can also write a prescription retinoid like tretinoin or Retin-A. Okay, Sunshine, how can I get my foot in the door within a med spa career space? Sunshine, apply, bring your resumes. Somebody will say yes. I have worked with several people that have not, that have had no experience. Like, if they are hustlers, if they are willing to learn, willing to train, like good personality, I'm like, okay, I have taken people from zero to like owning their own medical spas. So you just gotta like keep going. And yeah. And I think a lot of people are like, oh, they said they'll read the thing that says they require experience, and they don't even try. But I'm like, you got to try. I was hired with zero experience. Somebody like gave me this job. I didn't even want it, didn't even know about it. But they were like, you have the personality for this. This was only Jesus, you guys. There was no way I even knew about this. No way I was looking for this. And it was only God's plan. So just go. And I mean, I learned from zero. But I will say, if I didn't have a patient, I was in somebody else's room watching them and learning. If I didn't have a patient, I was talking to a rep. I was investing money, going to conferences, going to trainings, like really trying to hone my craft. I would go home, I would study my before and after photos of my patients. I would be like, hey, what could I have done better? I asked my patients, and still to this day, I'm like, dang, even these patients I've treated my whole career of 13 years. I'm not just like, oh, you're back, let's just do your regular Botox dose. No, we sit down every single time and I'm like, hey, how was last time? What's going on right now in life? Because every time it's different. Like, they could be like, I lost 30 pounds. Their face is going to look different. Or, hey, I usually come to you every 4 months, but this time I came a year later because I've been traveling the world. So we have to talk about what's going on. Give me feedback. If there's something that you see, like, and that I can do better, tell me. That's how I can, like, better serve you and then learn and serve other patients. I also really wanted to work with all skin types and tones. If you see my page, or if you go through my before and afters, I made it a thing. I'm like, I don't care who walks into this office. I want them to be able to feel safe, seen, heard, beautiful. That is like a big deal to me. I want them to be able to see themselves in other patients. So I always say, thank you. Shout out to my patients who have allowed to use their before and afters. Because I'm like, nobody would know these people have had aesthetic work done because it looks natural. So if it weren't for my patients agreeing to saying yes, and like, you can share these and use these as education, a lot of people wouldn't know. I've had so many people tell me, I've never seen another Indian girl that got this until I saw your page. I've never seen another black girl that's doing this until I saw your page. That's the whole point. I'm like, I just want to show you, like, you can get these treatments safely, look natural, but be smart about who you're seeing.